CRNA school, you have about a year and a half of didactic and about a year and a half of clinical. Every CRNA school is going to be different in where you are placed for your clinical rotations. You may complete all of your cases at one hospital and one facility, or you may go to multiple different facilities. I have a travel nursing background, and I also wanted to have exposure to anesthesia care team model, but also to independent practice models. And I wanted to work at a couple of different clinical sites because when you train only one place, you learn how to do things the way that that facility teaches their residents how to do things. I wanted to have exposure to a couple of different clinical sites. So for my school, yes, we have 4 away rotations. There are a few rotations in the state that the school is based in. However, almost every single student has to go out of state for at least one rotation. For me, that's not an issue. I was kind of planning on going out of state anyway, and I think that's going to be a great fit for me personally. If you have little kids and you can't leave the state, then that might factor into ranking your top choices of anesthesia schools. But for me, I knew that I wanted to have exposure to different practice models. I knew I wanted to have exposure to different sizes of facilities, rural, academic, a blend of independent and ACT practice, and I wanted to have that mix of all of the different clinical sites. So for me, this was part of the reason that I chose my program, but for you, you might be interested in a different sort of clinical setup. Hope this helps.